G'day folks, Dr. Claire Hudson here. And today, I'm going to cut straight through the rubbish and tell you about something that's been sitting right under our noses for years. After more than 25 years working in men's health, I've seen blokes spend thousands of dollars on supplements, treatments, and all sorts of fancy solutions for erectile dysfunction and prostate issues. But here's the thing that drives me absolutely mental. One of the most effective solutions costs less than your morning flat white, and hardly anyone's talking about it. Right. Let me ask you something. How much are you spending trying to fix things downstairs? How much has it cost you in confidence? In your relationship? In those quiet moments when you're lying awake at night wondering if this is just how it's going to be from now on? I'm going to be straight with you. Erectile dysfunction isn't a bloody life sentence. It's not some inevitable punishment that comes with getting older. Your body hasn't given up on you, mate. Sometimes it just needs the right support. And today, I'm going to tell you exactly what that is. The vitamin I'm talking about is folic acid. Yeah, you heard me right. Folic acid. Not some exotic supplement from the Amazon rainforest. Not some miracle pill that costs a fortune. Just plain old folic acid, the same stuff they recommend for pregnant women. And before you switch off thinking that's not for me, stick with me for the next few minutes, because what I'm about to explain could genuinely change your life. Now, you're probably wondering, if folic acid is so bloody effective and so cheap, why haven't you heard about it before? Why isn't your doctor prescribing it? Why aren't the TV ads banging on about it? Well, I'll get to that in a minute. But first, let me explain what folic acid actually does in your body, because understanding this is going to help you see why it works. Folic acid, also called vitamin B9, is absolutely essential for creating new cells in your body. But here's what's really important for us today. It plays a massive role in producing something called nitric oxide. Now, nitric oxide might sound like something from a chemistry lab, but it's actually one of the most important molecules for male sexual function. It's what makes your blood vessels relax and dilate, which means more blood flow to all the right places. Without adequate nitric oxide, you simply can't achieve or maintain a proper erection. It's that straightforward. And here's where it gets interesting. As we get older, and I'm talking from about 50 onwards, our bodies naturally produce less nitric oxide. At the same time, our folic acid levels often drop because we're not absorbing nutrients as well as we used to, or because we're on medications that deplete it, or simply because our diets aren't what they should be. It's a double whammy, and it's one of the main reasons why erectile function starts to decline with age. But here's the good news. Multiple studies have shown that supplementing with folic acid can significantly improve erectile function, especially in men over 60. We're talking about improvements in rigidity, duration, and overall sexual satisfaction. And it's not just about erections. Folic acid also supports prostate health, reduces inflammation, and helps maintain healthy hormone levels. I've seen this work firsthand in my practice. Blokes who come in feeling defeated, who've tried everything under the sun, and then after a few months of consistent folic acid supplementation combined with some lifestyle adjustments, they're like different men. The confidence comes back, the spark returns. And it's not just physical, it's that whole shift in how they feel about themselves. Right. Now let's talk specifics. Because I know you're sitting there thinking, okay, doc, this all sounds great, but how much do I take? And when do I take it? And that's exactly the kind of practical info you need. For most adult men, the effective dose is between 400 to 800 micrograms per day. That's micrograms, not milligrams. Don't get them confused. Some studies have used up to 5 milligrams for specific conditions, but you shouldn't be taking doses that high without medical supervision. Start with 400 to 800 micrograms daily, and you'll generally take it as a single tablet with a glass of water. Best time to take it? First thing in the morning on an empty stomach is ideal, but if that upsets your tummy, take it with a light breakfast. The key thing is consistency. Same time every day. Your body needs steady levels to do its work properly. Now, how long before you see results? This isn't a quick fix, guys. Folic acid isn't like those little blue pills that work in an hour. This is about rebuilding your body's foundation, and that takes time. Most men start noticing improvements after about 4 to 8 weeks of consistent daily use. Some notice changes sooner, others take a bit longer. But the benefits build over time, which is why you can't just take it for a week and give up if nothing happens. Where do you get it? Any pharmacy, supermarket, or health food shop will stock folic acid supplements. You don't need a prescription. Look for a reputable brand. I usually recommend checking that it's made to Australian standards. And here's the beauty of it. A month's supply will cost you somewhere between $5 to $10. Compare that to what you might be spending on other treatments. Now, before you rush out and buy a year's supply, there are some important things you need to know. First up, if you're taking any medications, especially anticonvulsants, methotrexate, or certain antibiotics, you need to talk to your GP first. Folic acid can interact with these medications. If you have a history of cancer, particularly prostate cancer, definitely discuss this with your doctor before starting supplementation. And if you're already taking a multivitamin, check how much folic acid is already in there. You don't want to overdo it. Some men shouldn't take high doses of folic acid at all. If you've got undiagnosed vitamin B12 deficiency, taking folic acid can actually mask the symptoms while nerve damage continues. So if you're experiencing numbness, tingling, or balance problems, get your B12 checked first. And here's something really important that I want to emphasize. Folic acid works best as part of a comprehensive approach. It's not a magic bullet that'll fix everything while you continue unhealthy habits. Think of it as part of the foundation, not the entire building. So what else should you be doing? Well, your diet matters enormously. Foods naturally high in folate, that's the natural form of folic acid, include dark, leafy greens like spinach and kale, legumes like lentils and chickpeas, asparagus, broccoli, and citrus fruits. The more of these you're eating, the better your baseline is. You also want to support nitric oxide production through other means. Beetroot is absolutely fantastic for this. The nitrates in beetroot get converted to nitric oxide in your body. Dark chocolate, watermelon, and garlic also help. And here's a tip. Foods rich in vitamin C help your body absorb and use folic acid more effectively. So having some citrus fruit or berries with your supplement is a smart move. Exercise is non-negotiable, guys. I'm not saying you need to become a gym junkie, but regular physical activity, and I mean at least 30 minutes most days, improves blood flow throughout your entire body, including where it matters most. Walking, swimming, cycling, anything that gets your heart rate up and keeps you moving. And we need to talk about lifestyle factors that are sabotaging your efforts. Smoking is absolutely devastating for erectile function. It damages blood vessels, reduces nitric oxide production, and basically works against everything we're trying to achieve. If you're still smoking, quitting is the single most important thing you can do. Heavy drinking is another problem. A couple of standard drinks is fine, but regularly overdoing it will impact your sexual function and your overall health. Stress and sleep are huge factors too. Chronic stress elevates cortisol, which suppresses testosterone and interferes with sexual function. Not getting enough quality sleep does the same thing. So managing stress through whatever works for you, whether that's meditation, time in nature, hobbies, talking to a mate, and prioritizing 7 to 8 hours of sleep per night, these things genuinely make a difference. Now, let me address the elephant in the room. If folic acid is so effective and so cheap, why isn't it being recommended more widely? Why isn't it the first thing doctors suggest? Well, there are a few reasons. First, modern medicine is often geared toward quick fixes. When a bloke comes in complaining about erectile dysfunction, there's pressure to prescribe something that'll work immediately. Folic acid requires patience and consistency, and frankly, not everyone's willing to wait 6 to 8 weeks for results when they could pop a pill and see effects in an hour. Second, there's no money in it for pharmaceutical companies. You can't patent folic acid. It's been around forever. It's cheap to produce, and anyone can make it. No company is going to invest millions in marketing a product they can't make serious profit from. The medications that do get heavily promoted are the ones with patents, the ones that cost a bomb, the ones that make shareholders happy. Third, and this is important, a lot of doctors simply aren't trained to think about nutritional interventions first. Medical education focuses heavily on pharmaceutical solutions. Nutrition often gets a passing mention at best. So it's not that your doctor is deliberately withholding this information. They might genuinely not know about the research on folic acid and erectile function. And fourth, let's be honest, our society wants instant gratification. We want the quick fix. We don't want to hear that we need to take something daily for 2 months, eat better, exercise more, and manage our stress. We want the easy solution, but the truth is, the foundational stuff, the stuff that actually addresses the root cause, rather than just masking symptoms, that's what creates lasting change. I've had blokes in my clinic who were skeptical at first. They'd tried expensive treatments, they'd been disappointed before, and here I am telling them to take a cheap vitamin and be patient. But the ones who stick with it, who give it a proper go, they're the ones who come back 3 months later with that look in their eyes. You know the look. Confidence. Vitality. That sense of feeling like themselves again. One patient I'll never forget. Let's call him Dave. Dave was 68. Been struggling with erectile dysfunction for about 5 years. He'd tried the conventional medications but didn't like the side effects. And they were getting expensive. His relationship with his wife was suffering because he'd basically given up on intimacy altogether. When I suggested folic acid along with some diet and lifestyle changes, he looked at me like I had 2 heads. But he was desperate enough to try anything, so he did it. 8 weeks later, Dave came back for a follow-up. And the change was remarkable. Not just physically, though he reported significant improvements in that department. But his whole demeanor was different. He was making eye contact, smiling, joking around. He told me his wife said it was like having the old Dave back. That's what this is really about, guys. It's not just about sexual function, though that's obviously important. It's about feeling like yourself, having confidence, enjoying intimacy with your partner, and not feeling like age has stolen something essential from you. Now, I want to address some questions that come up frequently. First, can you take folic acid if you're already taking medication for erectile dysfunction? Generally, yes. But check with your doctor. They work through different mechanisms, so combining them can actually be complementary. Some men use folic acid as their maintenance foundation and have the medication on hand for special occasions. Second, what about other supplements? Folic acid works well with other nutrients that support sexual health. Vitamin D, zinc, and magnesium are all important for testosterone production and overall male health. Omega-3 fatty acids support cardiovascular health and blood flow. But don't go overboard. More isn't always better, and you can absolutely have too much of a good thing. Third, what if you're vegetarian or vegan? Folic acid supplements are typically vegan-friendly, and you'll actually be getting more folate from your diet anyway if you're eating lots of plant foods. Just make sure you're also getting enough B12, which is harder to get from plant sources. Fourth, is there anyone who shouldn't take folic acid? As I mentioned earlier, if you've got certain health conditions or you're on specific medications, you need medical advice first. And if you're getting regular blood tests and your folate levels are already high, you probably don't need to supplement. Here's something else worth mentioning. Folic acid isn't just about erectile function. It supports overall cardiovascular health, helps prevent certain types of anemia, supports brain function, and may even reduce the risk of certain cancers. So even if improved sexual function wasn't on the cards, supporting your folate levels is still a smart health move. Your prostate benefits too. Folic acid helps reduce homocysteine levels in the blood, and high homocysteine is associated with increased prostate problems. It also supports healthy cell division, which is crucial for preventing abnormal prostate growth. So, you're getting multiple benefits from one simple, affordable supplement. I want to be really clear about expectations though. Folic acid isn't going to turn you into a 5-year-old overnight. If you've got severe erectile dysfunction caused by significant vascular damage or neurological issues, you're probably going to need more than just folic acid. But for age-related decline, for mild to moderate dysfunction, for supporting overall sexual health and prostate function, this is a powerful tool that's been right under our noses the whole time. The key is consistency and patience. Take it every day, give it time to work, support it with good nutrition, regular exercise, adequate sleep, and stress management. And maintain realistic expectations. You're working with your body's natural processes, not against them. One more thing I want to mention. Talk to your partner about this. Sexual health isn't just an individual issue. It's a relationship issue. Being open with your partner about what you're doing and why creates understanding, reduces pressure, and often improves intimacy even before the physical improvements kick in. The communication itself is valuable. Right. So let's wrap this up. After 25 years in practice, I've seen every fad, every miracle cure, every expensive treatment that promises the world. And you know what? The simple, affordable, evidence-based approaches are usually the ones that actually work long-term. Folic acid isn't flashy. It's not exciting. Nobody's making TV ads about it. But it works. It's safe. And it addresses a real physiological need that many men over 60 have. If you're struggling with erectile dysfunction, if your prostate health is concerning you, if you're feeling like your body's letting you down, consider giving folic acid a proper trial. 400 to 800 micrograms daily, taken consistently for at least 2 to 3 months. Support it with good nutrition, regular physical activity, and healthy lifestyle choices. And be patient. Your body didn't decline overnight, and it won't recover overnight either. But it can recover, and often does, when given the right support. Your health is like a garden, guys. You can't just plant seeds and expect immediate blooms. You've got to water it, tend it, give it time, and consistently provide what it needs. Folic acid is one of those essential nutrients that helps everything else work better. It's foundation-level stuff, and foundations matter. So there you have it. No fancy sales pitch, no expensive proprietary formula, just straightforward information about something that could genuinely help. If you found this useful, let me know in the comments. If you've tried folic acid for erectile function or prostate health, share your experience. Your story might help another bloke who's sitting on the fence wondering if he should give it a go. And if you're dealing with this stuff and feeling alone or embarrassed, don't. You're not alone. This affects millions of men, and there's no shame in taking steps to improve your health and well-being. That's what being a smart, proactive bloke looks like. Take care of yourselves, guys. Talk to your doctor, do your research, and make informed decisions about your health. Cheers.